Welcome back. We are on the heels of Patient Safety Awareness Week. One of the things that's key to patient experience is, of course, their doctor. And tonight we want to take a look at burnout for healthcare providers and the impact that can have. We'll talk more about it with Dr. Gail Gazelle, an assistant professor at Harvard Medical School. Thank you for joining us tonight.
My pleasure.
So when it comes to burnout, this is something that a lot of people are talking about. The conversation on mental health has really expanded in recent years. But when it comes to healthcare specifically, how big of a problem is burnout?
It's a very big problem. There are multiple studies now evidencing that 1 in 2 physicians struggle with burnout. Higher in some specialties like frontline emergency physicians, internists, family docs, but really pervasive in every specialty, from pediatrics to surgical specialties to ICU docs. And this is very concerning in terms of patient safety and what this really means for doctors who are taking care of vulnerable patients.
Now, is this sort of the nature of the beast with a high-performing, very demanding job, or has something changed in more recent years that's adding to it?
A number of things have changed, and I think primarily it's really what we can only call the corporatization of medicine. So medicine is really a big business in the United States, and that leads to a lot of problems in terms of physicians not having the kind of autonomy that they're used to having over their practice. It also means that the bottom line rules the day rather than patient needs and patient safety. And this impacts almost every aspect of physicians being able to take care of their patients, because we have a lot of administrators who are charged with saving money and pinching pennies. And that means that doctors have to see more patients in less time. They can give each individual patient less of their time. It also means that they're pushed to do more procedures, more surgeries, more invasive tests that can earn more money for the hospital entities.
That sounds like a very scary reality for the patients. How can patients advocate for themselves when they know how much pressure and stress their providers are under?
Well, physicians and others in healthcare are human beings, and they require rest, they require sleep, and they require respect and human decency. And I think the more we can show our appreciation of those who are putting their lives on the line, let's say during the COVID pandemic in particular, to take care of us as human beings and citizens, the more it helps them feel appreciated and then in turn want to go the extra mile for each and every patient. So I think the more we can kind of return to the human aspect, the human respect, the human decency, et cetera, it's going to help all of us get the good care that we need.
Is there any movement in the healthcare field to return to that previous normal? Is there any sort of momentum that is encouraging, in your perspective, that we might be able to return to that at some point?
Yes, I think there are a lot of positive signs because levels of burnout are so high. And as you say, because it's gotten so much media attention and attention within medical education, we're seeing some signs that there's awareness that we really can't continue in the same way. We're burning out our doctors. Doctors are leaving the field. 1 in 5 physicians has expressed an intent to leave their job. And we have a shortage, particularly of primary care physicians. It's estimated by the American Association of Medical Colleges that we'll have a shortage of over 100,000 primary care doctors within actually the next decade. So this is something that we all need to pay attention to because all of us and our loved ones will at some point need healthcare.
When young physicians are finishing medical school and coming into the field, what's the difference between what they tend to hope for, the idealized dream of what that career might be like, and then that reality that they're faced with?
I think there is a little bit of a gap there because we're taught in our medical training that we're the captain of the team. We're the one who's in charge. We're the one who kind of is the expert and calls the shots. And yet, when we get into practice, we find that it's a whole level of non-clinical, non-physician administrators who are actually the ones who are in charge and actually are dictating much about the practice of medicine. So for me, a lot of my work as a physician coach and as a mindfulness expert is really helping physicians manage stress helping them stay connected to their sense of meaning and purpose, and helping them restore their autonomy by helping them really learn how to navigate the difficulties that they face.
Yeah, if you have one favorite tip or piece of advice that you use in your work, I mean, for any physicians who may happen to be watching or for someone who knows somebody, what would that piece of advice be?
That piece of advice is to keep your eye on the prize. You went into medical school, you sacrificed so many years of your life in your training, and you deserve to feel really good about all the work that you do each and every day. We learn in our medical training to be our most harsh critic, and that actually contributes to burnout. It has an insidious negative effect. So we have to show appreciation to our healthcare providers. And as a healthcare provider, we have to really acknowledge our own accomplishments and connect deeply with our sense of meaning and purpose.
Yeah, beautifully said. Dr. Gale, assistant professor at Harvard Medical School, thank you so much for joining us and for all that you're doing.
Thank you.